All right, this is Thompson. I'm going to be giving a head to thoracic assessment. The first thing you would do when you walk in, you will give your patient some privacy, close the doors, pull the screens, and you will introduce yourself and tell them what you're going to be doing. Hey, how you doing today? My name is Israel, and I'm your nurse today. I'm going to be giving you an assessment, okay?
Okay.
All right, now first thing I'm going to do is I'm going to check the patient's wristband. Make sure I have the right patient. All right, Mr. Thompson. All right, and then I would check his level of consciousness by asking him a few questions. All right, first, can you tell me your name?
Ezra Thompson.
All right, can you tell me your date of birth?
12/29/93.
All right, do you know what I'm about to do?
Head to chest assessment.
Okay, all right. Do you know what president is currently residing?
Donald Trump.
All right, cool. So that's his level of consciousness. He answered 4 questions, so his level of consciousness is 4. So going right into it, I would start with taking vital signs. So I will start by taking his pulse. And his respirations. Right. So his pulse will be 84 beats per minute, and his respiration is 16 beats per minute. Now you will also get his blood pressure. We'll go ahead and borrow this arm here. So I got his blood pressure at 120/70. And at this point, you would ask the patient if he's in any physical pain. Are you experiencing any physical pain? And if you are, can you describe it on a scale of 1 to 10? 1 being 0. 1 being the lowest.
None.
None? All right. After that, I would start with the assessment of the head. And while you're assessing the head, you also want to take a general assessment and make sure that you don't see any type of lesions on the body, any discolorations in the skin, any moles or anything that you can just preemptively just see from the body. All right, you'll put on some gloves and perform hand hygiene and down on some gloves. And you would check the hair. Where you will start at the hair. You will look at the scalp and make sure you don't see any lesions or cuts or alopecia, any type of bruises or ulcers if they've been laying in the bed. Just check them on out here. right, make sure that the head is symmetrical and that it's the appropriate size. All right, and after you check the hair, you would take off your gloves, perform hand hygiene again. All right, and from there you will move to the eyes. You would check the eyes. You want to look at the eyelids, the sclera, make sure that's nice and white. The conjunctiva, make sure that's nice and pink and moist. You will pull down right below on the cheekbones to reveal the conjunctiva, make sure it's nice and pink. You will look for any type of, you don't want to see any type of redness or any type of soreness or swelling or anything like that in the eyes. You'll also want to check accommodation, and you want to check the cranial nerves 3, 4, and 6. Now how you would do that is you will take a pin and you will hold it about 12 inches or 12 to 14 inches away from the patient's face. We're going to check accommodation first. And what you'll do is you will instruct the patient to look at the pin, not to move their head, and you will move the pin close to their nose. All right, so just follow the pin, sir. Don't move your head or anything. Just keep your eyes focused on the pin. All right, and what you're looking for is the eyes to cross and to focus on that pin to make sure the eyelid, the irises are dilating to focus on the pin. All right, and that's accommodation there. And while you're right there, you might as well go ahead and check those cranial nerves by instructing him to keep his eyes focused on the pin and not moving his head, and make his eyes follow where the pin goes. And you would just move in 6 cardinal directions and always back to the center point. Just follow it here, over here, here, back, up there, back, down here, down here, and back. All right. You will also want to check dilation of the eyes, and how you would do that is you would instruct the patient to pick a spot on the wall and look at that point, and then you will shine your pen light into the eyes so you can see the eyes dilate there. And if one eye dilates, the other eye will also dilate at the same time. So the acronym PERLA, you would check for the eyes to be, the pupils to be equal, reactive to light, round, and accommodating. All right, so after you get done checking the eyes, you will go to the ears, and you will look for cerumen, look for any type of secretions or anything. If you had an otoscope, you can pull the pin back and look inside the ear to the tympanic membrane, and that should be like a pearly kind of grayish kind of look. And you would check to make sure that there's no kind of secretions or any type of perforations in the membrane there. All right, and from there you would check the nose. Make sure you look for any kind of deviated septums. I would instruct the patient to hold his head back a little bit. You can use your pen light to look in there, see if you see any polyps or anything that's obstructing that airway. You can also ask the patient if they've been experiencing any kind of problems with nose. Have you had any problems, any kind of running or drainage from your nose or anything like that?
No.
You haven't experienced anything? Okay. All right. From there, you will move on to the mouth. Now you will have you will put on some gloves in there, and then you will have the patient open his mouth. You'll want to check the insides of the mouth, under the tongue, the cheeks. You want to check for any type of cancerous tumors, or you want to check the tongue for what is the word? Thrush. You want to check the tongue for thrush. You want to look back there and make sure, if you had the little spatula, you want to look back there and make sure that the tonsils aren't inflamed or enlarged or swollen or red or anything like that. All right. Next, you will go to the neck. All right, and you will want to make sure the trachea is midline. You can feel the trachea if you come behind your patient and you ask them to swallow. Can you swallow for me? And you can feel the trachea there. All right, and you will also want to listen for bruise and palpate the carotid artery. So the carotid artery is right here under the jaw right here. And you don't want to apply a lot of pressure on there. You just want to feel it. All right. So it has a nice pulse there. It's about a 2+. And you will also check the other side and make sure it's the same. It's symmetrical. All right, and that's nice and 2+. All right. Now you will use the bell end of your stethoscope to listen for bruits. Now you instruct the patient to breathe in and then breathe out and then hold their breath for a couple of seconds while you listen. And you breathe in, breathe out. All right. And then you'll place it right on the carotid artery. And don't add that much pressure on there. And then you would check the other side as well. No presence of a bruit. And then you will also palpate the lymph nodes. And you will start right here behind the ears, well, in front of the ears. And you ask the patient if they're feeling any tenderness, any swelling, or anything as you palpate. You feeling any swelling?
No.
And behind the ears here, the occipitals, and the submandibular, then the clavicle up here. All right. Next, you would auscultate the heart and the heart sounds. You can stand up. All right. So there's 5 spaces that you should listen to. The apical valve is in the second intercostal space on the right. The pulmonic valve, which is on the second intercostal space on the left. Erb's point is on the third intercostal space. Then you have the tricuspid, which is on the borderline of the sternum here. And then you have your mitral valve space, which is on the 5th intercostal space right here, almost at the mid-clavicle line there. All right, and you will want to listen to those points with the diaphragm here. All right, so you want to find second intercostal space there and give it a listen. Listen to those S1 and S2 sounds, the lub and the dub. All right, that's the pulmonic valve here. Then move down to Erb's point. You want to kind of follow like a Z pattern. All right, the tricuspid. You want to make sure that you listen closely for any kind of S3 or S4 sounds. And then you can listen to the mitral valve here, which is also the apical pulse. So what you can also do here is listen to the apical pulse for a whole minute and get the pulse again there. For time's sake, I will skip this step. All right, and then next you would listen to the lungs. All right, so you would start at the apex of the lungs, which is actually right above the clavicle line there. And what you would do is you would listen to each side and compare each side to each other as you move further down as you systematically move your way down and listen to the lungs here. So you will start, I'll choose to start right here, and then you will instruct the patient to breathe in and breathe out, and you will listen to a full respiratory cycle. You will want to listen for any abnormal sounds like crackles, any type of wheezing, any type of rails, or friction rubs. Now make sure that your patient isn't hyperventilating. So if they start getting dizzy or anything, you could slow down. You could tell them to let you know if you're if you're getting a little dizzy. All right, and that's the anterior, so you will listen to the posterior. And now with the back, you have these two bony scapulas here that you can't really hear the lungs that well if you listen to those points. So you will follow the apex of the lungs towards the top here, and then come down in between the scapula and the vertebrae here, and then follow that pattern down that way. And you will still do it the same way by listening to each side. And while you're doing this, you could check the skin of the patient, make sure that you're, looking for any type of abrasions or any type of ulcers or any type of lesions of sort. All right, then after that, that's pretty much head to thoracic. You can give the patient a pair of gown back. Thank you. Also, one other thing you can assess is skin turgor while you're checking the pulse, and also capillary refill. So you just bunch up a little skin like that, make sure it bounces back real nice and smooth like, and then you will take the fingers, press the fingers there, and make sure that cap refill is under 3 seconds, and look for any type of clubbing in the fingers. All right, and that pretty much wraps that up. That is head to thoracic, and yeah.